Hi guys, thanks again for joining me. I've been having a couple of thoughts on some cautionary advice when you seek treatment. I'm taking this from some pretty specific incidences that I've known have happened. One thing that comes to mind is your medical record. If you disclose certain things to your therapist, obviously that's going to be documented in your medical record. And there is HIPAA where your therapist can't just release information. But this day and age, when there's talk about cracking down on gun laws, I think they even call it red flag laws in certain states, where if you endorsed any suicidal ideation, if you've ever been into a psychiatric inpatient unit, some of that stuff might be used against you to take your guns away. When you disclose that you're suicidal or you've had thoughts, part of the therapist's job is to ensure your safety, and that might mean hospitalizing you. It might mean ensuring that your firearms are taken out of the house, and that can go several ways. That can be a friend or family member removing them from the home. That could be they're stored at the police station. It could be different scenarios, but I think you need to be aware that there is no 100% guarantee that a court system, a judge, a mental the doctor, psychiatrist on the inpatient unit might use that and petition the court to say that you don't need to have guns, you're too much of a liability. And so there's I just need to caution that there is no guarantee. It used to be back in the day, oh, your guns are fine, we just want to make sure you're safe, go get the help you need. But I don't know, different states are cracking down more on that. I know when you do a background check to purchase a gun, that could be flagged that you've had any mental health treatment. And so who's to say, oh boy, this guy, he must really be hurting or crazy or whatnot because he had all this treatment and not really knowing the background of things. So I know guns are important to some folks, and it is our right to bear arms, but I just know that that's come up many times throughout the years of that. Another thing, what you say is documented in your health records. There is HIPAA protection, but let's say you're in a child custody battle. The opposing attorney subpoenas your records, judge orders it. There are some laws protecting that information, but if you get a clerk or a receptionist or someone who is new, that can pull your records, and they get a subpoena that comes across their desk, they might, oh my goodness, I better give them everything. I mean, there's just things can happen like that. I would encourage you to review your records. You have a right to your records. most health records are online now, where you can log into your account and see your records. But if you are going through therapy, I would highly recommend you maybe getting some copies of the progress notes, just so you can see what the therapist is writing about you. So anyway, that's your right there. In that same regard, I want to say this nicely, but don't piss off your therapist. Again, it's not every therapist, but I have seen it happen where, let's say you don't show up for your appointments, or you're not progressing in treatment like you should be, whatever the case may be, something that your therapist doesn't like or whatnot, you could be labeled non-compliant or treatment resistant, and that all that could take is, I didn't show up a couple times. Therapists could document in there, treatment resistant or whatnot, especially if you go through like a substance abuse treatment program. That can show up on your record. If you have a relapse or something like that, you'll kind of get that label maybe thrown in there of just non-compliant with treatment, and that can follow you as well. So let's say you're going to an agency with one therapist and that doesn't work out for whatever reason, and you want to go to another therapist in that agency. They're going to talk. The two therapists are going to talk. They're going to see your records, and that, if that comes up on their radar of, non-compliant or whatnot, that might already paint a negative view for the therapist that you're going to be seeing. We would hope that the new therapist would give you a chance and learn more about you. But sometimes you can already have a bad reputation right off the bat. So I just think it's important for you to kind of lay eyes on your records, just to see what's being documented about you, see if it's accurate. Sometimes things get misinterpreted in session, and or specific facts can get miscued and put in your record, and I just think you need to be aware of that. So when I say don't piss off your therapist, I mean there's wording in progress notes that can give off that vibe like you're just not getting it, you're just not getting with the program, and that could give you a bad reputation or whatnot. One final thing that kind of comes to mind is treatment team meetings. So sometimes you'll be working with a therapist and they might not know what to do with you, how to treat you or whatnot, and so they'll staff your situation, your case, with other professionals. Be a part of that. Be a part of that. The agencies that I've worked at, the patient can come into the room and we're having a team meeting about you, so you should have say in your treatment. So if you ever hear treatment team meeting or whatnot, I would try and be involved with that, because it is your care, it's your life. Unfortunately, those treatment team meetings are usually, it's not to brag on a person. It's not to say, wow, I'm doing such great work. It's usually like, I'm stumped. I don't know what to do. Or this person is just, I've tried everything and it's not working. Or it's usually a negative tone, connotation. So, I don't know, take that for what it's worth. It is, the gist of it is to try and get feedback on how to change things up in therapy, but too many times I've sat in those where it's basically bashing the patient. well, this person has such and such disorder, and so they're not going to work well with anybody, and they're just gaming the system, or whatever it is. And it's kind of disheartening to hear that. And so in any case, yeah, if there's any kind of meetings about you, especially about your treatment, please, be a part of that. You should have say in it as well. That's pretty much it. The one thing, going back to suicide, if you endorse that to your therapist, you can expect probably everything to stop, and they're going to hone in on that and focus on that and really assess for your safety and make sure you're safe. And if that involves voluntarily or involuntarily hospitalizing you, they have the power to do that. A therapist does have the power to say this person needs to be committed, and so that's just part of our kind of code of ethics, and wanting no harm to come to the patient. So if you're obviously, you want to be comfortable to share that if that's an issue for you, but be specific. There's a difference between I wish I was dead and I have a plan to kill myself. There is a difference there. Now, some clinicians, some nurses, whatnot, they might not know the nuances of that, and so they hear suicide or thoughts of death, and the red flags go up and all that. And so if you have a new clinician, they might get a little bit more excitable about that, as opposed to someone who's had years of experience and can tell, like, no, you're just feeling pretty miserable. You don't feel like waking up. I get that, but you're not actively trying to kill yourself. So make sure you make that clear with your provider, because it is in the wording. And if you word it that there's like imminent danger, more than likely you might be hospitalized. So in any case, that's just something that I've noticed too. And my style has always been to, if we can't really contract for safety, if the patient doesn't feel safe, they don't like their thoughts, they don't trust themselves, my style has always been to get them to go into the hospital voluntarily, because you do have a little bit more rights and freedom if you check yourself into a place voluntarily, instead of if you're court ordered to go to a psychiatric unit. So yeah, that's pretty much what I have for that. Apparently I haven't enabled comments in my videos, so I'm gonna enable the comments. Hopefully I can get that right, and you guys can put some questions in there. I love to interact with you guys and chat about these topics, anything that's on your mind. And again, thank you for tuning in.